And for days now, we've been telling you how doctors are urging you to stay home this Thanksgiving to avoid spreading the virus. Well, now we're digging into what you need to know if you still decide to go forward with a traditional gathering.
ABC Action News reporter Lauren Rosella went to an expert to find out what you should do if someone at the get-together tests positive.
After big holidays, doctors typically see a spike in COVID-19 cases across the country. So doctors say if you do go to a Thanksgiving gathering and someone tests positive or later ends up showing symptoms, there are a few things that you need to do. First, assess if you yourself have symptoms of the virus. These include cough, shortness of breath, difficulty breathing, fever, chills, loss of taste or smell, diarrhea, vomiting, and severe headaches and body aches. If you do, medical workers say go get a test right away. But if you don't have symptoms but believe you may have been exposed, doctors say that you and your immediate family needs to self-quarantine, then wait about 5 days to get tested.
And the reason for doing that is that you will probably get a false negative test if you do the test in the first 1 or 2 or 3, 4 days since the exposure, because there's not enough viral load in your nose.
Something else important to keep in mind, just because you get a negative test result after the 5 days does not mean that you are necessarily in the clear. Doctors say you can still become positive for the virus, and they say that you should continue to quarantine for a full 14 days after exposure.